You don't have to get a hit in the head to get a concussion. So some people think you just have to get a hit in the head to get a concussion, which most of what we see is some type of trauma or accident hit to the head. But you can get a shot to the body, and the forces that move your neck to your head can also cause concussion. So the interesting part about concussions nowadays is that we don't label them as mild, moderate, or severe concussions. It's either you get a concussion, you've got one, and you get diagnosed with one, and you've got one. And so we don't really label them anymore because every concussion, even a concussion, if somebody's had more than one, every single one of them is different. Out of the thousands that I've seen, none of them are exactly the same. Not even the same person. Usually, so parents and coaches have to be aware that it doesn't just need a hit in the head. What you're looking for is symptoms. What you're looking for is that athlete doesn't feel quite right. They get, after a play, after they fall, something happens, and they're saying, okay, I'm a little dizzy. I have a little bit of a headache, fogginess, those type of things. There's a slew of symptoms, light sensitivity, sensitivity to noise, and the list goes on and on about what those symptoms are. And with those symptoms, you have to be able to, one, educate your athlete. That's the hard part. You talk about youth and kids, and then they had a headache before. They might have a sinus headache. We live in San Antonio. Allergies are everywhere. So they're used to maybe having a little bit, but they can push through it. But it doesn't happen after a certain incident. And so in some of these symptoms, they can show up 24 hours after because you have adrenaline, right? And so you kind of ignore, you didn't quite feel it. Pain tolerances, they're in the zone for that game. And then it's after the game. It might be the next day that they start to go, I don't feel quite right. Something's wrong. Usually I tell parents, is this your kid? Are they talking to you as much? Usually after a game, they usually are this talkative or they're not. They're kind of staring at you a little bit longer, processing a question, which they normally don't do. It's looking for those little nuances, and you can usually see them as well, especially my parents and coaches, if they know their athlete really well as well. They're like, they're not saying something quite right. I've had other athletes actually say, hey, Johnny over here doesn't seem like he's answering my question quite right. Hey, doc, can you go check him out a little bit? Or they start to go to a different side of the sideline, or they're not doing a play that they're supposed to be doing, and they know it, and they just didn't remember. So those are the things that we kind of have to look at and see. Those are some of the symptoms that you'll get. But usually you'll get headache, sensitivity to light, noise, dizziness, those type of things.